I do love this work, but I just feel like it's time. I think you know when it's time after all these years, and I'm doing it now while I'm relatively healthy, and I have a new grandchild and a couple of other grandchildren I'm involved with, and I love to travel. And I think it's just time for me to go on to a new phase in my life. In the past few years, I've lost several friends, and at either before retirement age or right at retirement age. And I just think that it's time for me to be able to do what me and my husband's semi-retired. So, we've been together since I was 15, I think, maybe even sooner. And he grew up a street away from me. His sister was my best friend, and we just have always been together. But my mother had polio when I was 5 years old. And so they remember the nurses sneaking us up to the polio center to visit her. And ever since then, I always wanted to be a nurse. So I went to New England Deaconess nursing school. And then I started working here after I got married. I worked at Deaconess for a while. I started working here after I had my children. Worked upstairs in long-term care for a couple of years, and then this opening happened to open up, and I was lucky enough that my mother was able to babysit, and I was able to give adult day health a try. It was a fairly new concept, and I thought it sounded really interesting to do. And I've loved it ever since. I always said they were going to drag me out kicking and screaming, but yeah, I really thought at first I might be a little bored with this type of program. I haven't had a day here that we haven't laughed, had a good time. I've never been bored. There's always something going on, and it's a great program. I benefited myself with my father after my mother passed away. My father came to the program. Wasn't thrilled to come at first, but once he started coming, he loved it. And I saw that, geez, that the days that he came, I didn't have to go over there at night and check on him because he had had a full meal. And it really relieved a lot of the stress in watching my dad after my mom passed away. So he was 80 at the time when he came to us, and he was, I don't want to go in with all those old people. I'm like, Dad. But once he started coming, the socialization was a big deal because he wasn't alone anymore, and he just absolutely loved it. So they've seen my children grow up, kids graduating from high school or college or marriages or babies, and our families even visit. Now we bring the grandchildren in to visit and that. So every day someone comes in, there's always something going on. But when they come in and say, "Hi Debbie, how you doing?" and I have a surprise for you, when I'm dealing with families and being able to actually do patient care. And nowadays nurses, lots of times they're behind the med card or behind the books or whatever. And here you have hands-on. We deal every day with all of their issues, and you become part of life. And I think we make a big difference in most people's lives, which is really something that touches my heart. To know that as a nurse I've been able to do this type of care. We do blood sugars, we give medications. If a blood sugar's off, we notify families and let them know. We do dressings. We bring people into the bathroom if we notice any type of skin problems. We can let the family know. We do a lot. Adult Day Health has actually been a holistic approach to elder care long before that became a big deal. And we can do a lot of preventive medicine, which I love. So many of these people, if they weren't coming to Adult Day Health, they would end up in a nursing home, or they would end up sick in the hospital back and forth. We have people who have psychiatric issues that were getting hospitalized every year until they started coming to Day Health, and haven't been hospitalized in 5-6 years. They actually have lobbied many representatives and senators to increase the budget for Adult Day Health, because a lot of them are closing because they just can't afford to stay open because of what their expenses are growing, but the reimbursement hasn't grown much over the years. Planning on taking golf lessons, which is something my husband and I enjoy. In September, we take our grandsons camping in August, and then in September we're going cross country for 5 weeks with our best friends to travel. And normally I go to Europe every year with Weymouth High School as their chaperone, so that's been terrific. So, daughter Amy lives in Weymouth with my 2 grandsons, Luke and Will. Luke is going to be 15, and Will is 9, and she works for an insurance company in Norwell called Garrity Insurance. And then Kelly Meads. Kelly is my other daughter. She's works as a guidance counselor at Weymouth High School. I'm still going to be around. I told them I'll fill in if something comes up, because Sandy and I have worked very closely doing a lot of the contracts and that takes. I can't say enough about the staff at actually all 3 centers, one in Hingham, Quincy, and here in Weymouth. They're so caring and get so involved, and they just, all they want is people to taken care of well, and to have a good time during the day. And it's every day. It happens every day, and everybody goes home happy and healthy. And all of them have worked here for quite a while too. I've been very lucky. We've had very consistent staff over the years.